We have been able to explore women's services to help us to have a better understanding what needs to be changed and what needs to be improved.
I had a C-section. Being my first time, my first child, the experience of C-section, I felt that the support I got after was limited. There was one person on the shift, one nurse. I was in so much pain and I asked for painkillers, some medication, and she told me that there was no one to administer it. And so I spent the whole night in pain until the doctors came around in the morning. So it was really, really hard for me actually. And this was on a ward in the hospital. So I felt the care I received was not sufficient, was not enough to get me through that time.
There was an overall feeling of scepticism and a lack of empathy and support, especially for those who experience trauma, racism and discrimination.
My sister recently gave birth, and the hospital experience of staff, including doctors and specialists, has definitely decreased in terms of empathy. She had to wait hours just for a cup of water. This was after giving birth via C-section. Previously, the recovery of a patient was emphasized.
More education, encouragement and support for fathers. Support groups for trauma, racism and/or discrimination, but within hospitals. Rethinking the complaint system and more awareness on how to complain. Staff need to be better educated about the different cultures and their own body language. The NHS needs a lot more funding for their staff and for mental health support for their staff.